and first of all, just to thank you guys for getting the troops together to take a look at the Public Health Performance Management System known as the VMSG dashboard. I might want to ask you a question. I know that you guys have been accredited since 2014, and have, Chris, have you guys started on your reaccreditation process?
I did not hear what you just asked.
Have you guys started on your reaccreditation process?
Oh, yes, we are in the process of reaccreditation.
Okay, great. And well, let me just go ahead and introduce the deck. You haven't seen it either. I think Bob is the only one that might has seen the presentation. We're going to get you started in warning you that this is a drink from a fire hose of a presentation. So we're going to get started with that. The VMSG dashboard was developed in Maricopa County Public Health Department. And we've been in public health for about 15 years. We never left. We do not dilute this product to any other industry. We've stayed with public health this whole time, developing a comprehensive operational planning and execution system. And by comprehensive, I mean what we take a specific set of operational plans. We take a specific set of goals and objectives and drill them all the way down to a specific set of activities. And then by following the Deming cycle, the PDCA cycle, plan, do, check, and adjust. And that the check and adjust is one of the key things, to be able to check your progress and then adjust the plans accordingly. With the system, we actually have been fully demonstrated by FAB, fulfilling the domain 9.1.1a, a fully demonstrated performance management system. About 4 years ago, when FAB came along, or 4 years ago, 2011, in Maricopa County, we didn't even know we had a fully demonstrated system until FAB came along. And then since then, we have about 140 health departments around the nation that are in various progresses over for accreditation, reaccreditation. The system, excuse me, I just got lost. I'm actually following as well. With Fred Erickson is a developer of the system, and he does the actual presentation. I just get my 10,000 words out, and I just, then turn him loose. So I am going to go ahead and have him start taking over the presentation. You ready, Fred? Okay. You can talk now, I promise.
Thank you so much. I appreciate the permission here. Okay. Well, thank you, everybody. I know you guys had asked to have this recorded so that we can put it up on YouTube for you and give you access to it for other folks who may not be able to see it. So we're recording the session, and we will, again, right after the session, we'll post it up on YouTube and send out the links to everybody so you can take a look at it, maybe even go back and review some of the things in here. Andrea, thanks so much for the opening here. As Andrea mentioned, as we get down into the FAB world, the system has been in use by about 140 health departments. Most of those folks have gone through the full accreditation cycle, and many of them are in the reaccreditation cycle now. One of the things that we chose to do at the outset was to make sure that the system was accessible by everybody in the department if you choose to. FAB is very big. Things like Measure 9.1.1, where they talk about pushing performance management down to every level in the organization. We really believe that you can streamline the efficiency of the organization and all the plans and keeping the plans up to date and moving the plans ahead by involving as many people as possible. So the VMSG dashboard is a full multi-user system. Everybody's got their own unique username and password, and that username and password then takes them into specific areas of specific plans that allow them to keep their area of responsibility up to date here. You can also include, if you choose to, through your CHIP and your CHA process. Obviously, you've included, external partners, hospitals, and community partners and such. You can give those folks direct access, what we call partner access, which allows them to help you to keep the information around the plans up to date. So instead of you having to go out and contact somebody and say, hey, how are we doing against these 5 activities that you've been assigned, and then you go back and put it in the system will communicate with them automatically and allow them to update their information. So it really does help short circuit that process and increase the efficiency here. Let me give you our definition of performance management. A lot of systems out there that say they're performance management, when you break them down though, they're one piece of it. They're performance monitoring. Performance management encompasses kind of 3 areas. So number one is, as Andrea was talking about, operational planning. Our definition of operational planning is taking each of your plans, you see the fab 6-pack of plans up here, typically a great starting place, and taking those plans all the way down to a specific set of activities. They're going to be accomplished by a specific assigned team of people, a specific time frame, and a specific measurement criteria. So getting those plans all the way down that level allows you to drive those plans very finitely forward here. So now the plans are operating here. Now we need to do this thing called performance monitoring. This is what most systems do, and they're going to allow you to watch the progress of your plans as long as you input the information properly here. So we have performance monitoring at multiple levels. We'll be talking a lot more about that during this demo here. But during the performance monitoring process, what you're looking for are anomalies. You're looking for something kind of to head south. So if you see something getting out of whack, you need to be able to make those corrections, and you want to make those corrections in real time if possible. A lot of times in planning cycles, we've been through this for, as Andrea said, I think that's about 18 years in public health with us now. Done a lot of work on strategic and operational plans. And what typically happens is you're going to go back a quarter later, you're going to go back a year later at the planning cycle, go back and review how you did against the plan. Now that's okay if everything was working okay, but if things got out of kilter pretty easily or pretty quickly, you got to be able to make corrections in real time to be able to get those back on track. And that's where this PDCA cycle comes in. I know our nomenclature is a little different with plan, do, check, and adjust, but we're going to show you exactly why in a minute here. So this cycle, every plan is going through this cycle so we can continually monitor them and make corrections to the plan as we move forward here. As Andrew mentioned, the system is truly an operational planning and execution system. The planning model that's integrated into the system was actually developed primarily in public health over the last at least 20 years that I'm aware of. And this model has seemed to hold true very well within public health with all the departments that are working on it. We did take the model to our friends at Arizona State University after we looked at it what public health had them kind of verify that it was a best practice in operational planning, and they came back and said certainly it was. So here's what it looks like. At the top is your organization. In some cases, it's merely the health department itself as the organization. In some cases, they expand that to consortiums. So maybe you got a consortium of 5 or 6 health departments. We have a Northern Montana Central Public Health, who is the 6 health departments who've come together to be able to kind of form a consortium and go through the accreditation process. So it can be multiple different things. It can be a state, like the state of North Carolina has all the health departments kind of under the state. Is it allowed to go there? Oh, okay. So typically, again, it's the health department, the organization level. Underneath that, we have your org chart, which is just your divisions, your offices, your programs, and how they relate to one another inside the organization here. For each of those groups, we call them, you got a set of services or initiatives. These are the things that you're going to do within that group for the community or for the organization here. Services are ongoing things that we do. Initiatives are things we want to do in the future. An example, WIC does nutrition consultations. WIC has always done that. They probably always will do that. So that's an ongoing service. In the world of WIC, again, about half the states in the nation currently have transitioned from issuing paper-based WIC checks to electronic benefits transfer. WIC is driving everybody to get to that point for efficiencies and things. However, the other half of the states who haven't gotten there yet have an initiative to get there. So an initiative is merely a future service. The big difference in the system is that the dates on initiatives obviously are future dates because you're trying to get to that point. Now, for each of those services and initiatives, you're going to have a mini project plan on how you're going to get there. The kind of the how we do it part, we call it. So each service has a set of goals, each goal a set of objectives, and each objective a set of activities. And I would say probably if you looked at your existing plans, they're probably laid out very similar to this. Now, sometimes there's nomenclature differences, like sometimes objectives are strategies and sometimes activities are action steps, but basically the same thing as you're going down. So what we're going to do in the next few minutes, we have a little department we developed called USA Public Health. We're going to walk through the development of an operational plan, and we're going to take it through this monitoring cycle, and we're actually going to take it through the PDCA cycle so you can see the adjustments and the tools that are involved here. So I'm going to tab over to the live system here now. What you're looking at, we'll come back to in a few minutes, is the dashboard screen, kind of the namesake. This is one of those performance monitoring tools. For now, however, what I'd like you to look at is these tabs across the top. If you look closely, you'll see that tabs are exactly the same as that pyramid I just showed you, flipped on its left side. Organization, groups, services, goals, objectives, activities here. I'm going to go to my groups tab, and I'm going to go down to my community health division now. So now everything in the pyramid that I'm looking at is within community health. What are the services that community health provides? So you can see these. We're going to look at the Safe Kids program today, and specifically we're going to develop an operational plan for the car seat program within the Safe Kids program. So the Safe Kids is the what we do part. I'm going to drill down to the goals here. The first goal we're going to talk about is promote and provide child passenger safety education and resources to partners in the community at large. So this is where the car seat program fits. As we go down the pyramid, we get more and more specific. So number one, we have a traffic signal out here. The traffic signal is merely an indicator of how we're doing against that particular goal. We chose a traffic signal because it's pretty intuitive for everybody that, green is go, everything's good. Yellow, caution, maybe something's going wrong. Red is, oops, something has gone wrong. And then the gold bar indicates a successfully completed planning element in this case. To go along with the traffic light, we have this notes field down here. So anytime you make a change to a traffic light or the note or the goal itself, you're going to probably put a note in there as to why and what you did. So, if I change the traffic light from a green to a yellow, I'm going to put a note in there that, Fred changed his traffic light from a green to yellow for some specific reason here, so that anybody else looking at this, again, multi-user system, lots of people can have access to that. Instead of having to contact me and find out why I changed it, there's a note in there that says, here's what we're doing, here's why we changed that in there. Now, for this particular goal, I'm going to look at the objectives here. Objectives, to get more specific. First thing, objectives are typically SMART. So they're specific, measurable, attainable, realistic, and time-based or time-bound, depending on your definition. So as an example, by June 30th, we're going to distribute 20 car seats a week to families through these various programs. So it's a SMART objective. The other thing that we do at this point in time is we actually assign an objective lead. So in this case, we've assigned Diane Cox as our objective lead. Diane's responsibility here is to get us to 20 car seats a week by the end of the fiscal year. Not necessarily the person who's going to do it, but she's probably a project manager or program manager, something along that line. Now, the objective is still a target. The target is to get to that 20 car seats a week. Now we're going to go down to those specific activities, if you will, the operational portion of the plan that says, here's exactly how we're going to do it. So you'll notice down at the bottom, we have a lot of detail around each particular activity. So we'll walk through that as we go through the activities. So number one, establish a funding stream to get to 20 car seats a week. Car seats aren't cheap, so we're going to get the money from probably the Safe Kids program to facilitate that. Over here, we have a performance metric, which says, how do we know when we successfully completed the activity? So we have a activity of establish a funding stream. Once we've acquired funding, obviously we've completed the activity. There are multiple types of activities. Every activity, however, has a specific team of people, a specific time frame, and a specific measurement criteria. The one we're going to talk about right now is a project-based activity. And the big difference on that is it's first of all, the most common and the most simplistic. The measurement criteria is merely a % complete. So how far along are we in the process? And if you think about it, you can apply that to many, many different things. Now, if I have an activity that I want to measure a specific quantity, so for instance, number of car seats installed or number of restaurant inspections completed, something along that line, I can use a QM activity. QM activity allows you, instead of entering a % complete, to enter actually a finite number. And that number can then be either compared against a target to give you that % complete, or it can be an open number that if you're just counting up like one of the health departments uses it for plumbing inspections. There's no target number because it's only on demand from clients in here. There's a third type of activity, the QA activity. QA, the big difference is instead of a beginning and ending date, it's repetitive. So it's got a frequency. The frequency being weekly, monthly, quarterly, annually, all the way out to 5 years, actually, if you wanted to. And there's some other tools that we'll be talking about that go around that. But basically, it's repetitive. So if you're doing something you're measuring weekly, it'll automatically keep the dates up to date for you and such here. As I mentioned, every activity has got a specific team of people here. So I can go down and select my team lead. I can have one of those, and I can have as many team members as I want. And the nice thing is the team members can come from anywhere in the organization, or if you choose to, you can include those external partners as team members. So you can get, a tight-knit team around a specific activity here. Over here on the right, this FTE column, this is an optional field, and some people use this for a couple different things. Number one is quantifying the human investment in this particular activity. So in this case, we have Diane and Mara each saying it's a 0.1 FTE, or about 4 hours a week of their time to do this activity within the time frame of the activity here. So what that allows me to do then is say, okay, what's the level at the activity here? So down here we have a 0.2 FTE here, about 1 person day per week to complete this activity. If I look at all of these activities and roll it up to the objective, down here you can see this 0.6 FTE, which is what's that 3 people day per week to accomplish the activity of getting to 20 car seats a week. So things like cost benefit analysis and determining, is this the best use of our limited resources based on the costing and the return, if you will. Now back to our activities here. We have the beginning and ending date here, as you mentioned, and we also then have this % complete for the project-based activity. Now I go down to the next activity. So we've got funding. The next activity is, let's create a relationship with a local installer to be able to manage the program. So when people come to them, they're going to qualify them to make sure they fit within the income demographic. They have kids, and obviously they need car seats. And then they're going to install the car seats for them. Down here at the bottom, we have the ability to assign those external partners. So there's an external partner database that you manage. We have Andrea's car seat installation and Andrea shown as our external partner. And again, if we choose to, we can give Andrea that partner access back in the system, which basically allows her to help us keep the information up to date, like how many car seats she installed each week. The next activity then is get the word out. So we've got funding, we've got a partner to manage the program. The car seat program is applicable to folks who fall under a certain income range. So we're going to go out to probably specific neighborhoods. We're going to get the PIO office to drive that for us. Go out, get those people to go see Andrea, who's going to qualify them and install their car seats. Then we're going to get down to kind of the bottom line, which is we're actually going to install 20 car seats a week. So what we just did in the last 5 minutes is developed an operational plan for the car seat program. And here's what it looks like in the pyramid. It was under Community Health Division, the Safe Kids program. The goal is to provide car seats to those who can't afford them. That SMART objective is by June 30th, 20 car seats a week to families through the various programs. And then that set of activities that's going to get us there. So that is the operational plan. You're going to find that over time, most of your plans will come down to this level. And when you get it down to that level, it makes it pretty easy then to guide yourself through the activities to make sure you're going to meet the objectives and on up the pyramid here. Now, let's take the plan we just developed and walk it through that PDCA cycle. So what we just did is the P part, obviously, the planning part. We developed an operational plan, got a good solid plan. Now, put it into action here. In the do phase, what we're probably going to do in this particular case is go to our funding source, get them to provide money to Andrea to buy car seats. Going to go to our PIO office, have them kick off the marketing campaign, for lack of a better term, and get the word out to those specific neighborhoods so those folks can go to Andrea, who'll qualify them and install their car seat. In the background, while we're doing that, we're going to implement this thing called real-time planning. What that is a combination of an automated, intelligent email notification system. So it sends out emails to people who need to update information only when they need to update the information. And then on top of that, there's a link in that email that's going to take them into what we call the quick update system, which is a super simplified set of screens that allow them to update the information, like how many car seats they installed. So in this case, we're probably going to set this up for maybe a weekly notification going out to Andrea. That notification is basically going to say, how many car seats did you install last week? She'll click on that link, go into the quick update screen, put in 21 car seats, hit save, she's done. About 1 minute of her time a week to keep this information up to date. So let's say we're going to do that for 10 or 12 weeks as we ramp up the program. At some point in time, somebody's going to come up and say, hey, how's that car seat program working out? Check phase. In the check phase, we're going to tell them. So what we've done is we've selected this activity of installing 20 car seats a week. I go down to this little chart button here, click on that. That's how we're doing. The blue line, as you see, are the data points that Andrew's been entering for us every week. The green line is that target number of 20 we set. The red line you can set anywhere, but we call that a fallback number or a safety zone. What that's saying is if I drop below this line, I'd like to be notified because something's obviously gone wrong. The way we do that is every time Andrea enters a value in here, it's going to compare it to the red and the green line and set the traffic light. So in this case, the traffic light is red. Up in here, it's yellow. As we get above the green line, obviously it's green. So we call this, by the way, micro level performance monitoring because it's a single activity over time. And looking at the chart, it says it took about, 4 weeks to ramp up. And then we got right up into our zone of 20, 21 car seats a week, exactly where we thought we'd be. So now going back to the PDCA cycle, that was the check phase. Select the activity, click on the chart, you're there. Now, we're going to go into the adjust phase. There's kind of 4 different scenarios here. The first one is no adjustment necessary. Looking at that plan, we're running right along exactly where we thought we would be. No sense of making any adjustment if it's working here. Don't fix it if it's not broke. We're going to go on through the cycle again. We're going to hit the check phase probably, let's say a month from now, look at the chart again. Everything's still good. We continue on. Now I'm going to take you back and I'm going to switch scenarios a bit. If this were the activity of installing 20 car seats a week, first thing we're going to notice is the yellow light. Based on what we just talked about in the chart, it says we're probably sitting in between the red and the green line. So let's go verify that. Sure enough, it's like we capped off at about 15 car seats a week. So what we know now is that we're not making our target number. What we don't know is why. So let's go figure that out. We're going to go back to the activities and just walk through them. Number 1, establish a funding stream. Gold bar says we're done. Number 2, relationship with local installer. Gold bar says we're done. Number 3, PIO is going to do our marketing for us. Yellow light. Something's going wrong here. This is where the notes field comes in. I'm going to go down here and see what it says. Whoever set that light to yellow, put a note in there. It says, may not be reaching the proper demographic or the plan is set too high. Okay. So our problem, obviously, is our marketing issue here. So what we're going to do is grab that chart. We're going to walk over to our PIO office, sit down with them and say, hey, guys, here's what we're seeing. Can you help us understand? Maybe the first answer we get from the PIO is, well, let me tell you what we've been doing. You guys came to us. We all sat down and decided that these are the neighborhoods based on the financial demographic of the program here. We've been out there with some posters and flyers. We're using the Nextdoor app, which is a social media for neighborhoods app. We're using that to get the word out to those folks. We've done some traditional marketing through, newspaper and radio, getting the word out. We think we've done a really, really good job of getting the word out to those folks. Perhaps we just overestimated on the plan, do you think? Maybe instead of the plan being 20, maybe the plan was really 15. Maybe it's a real-time adjustment here. So in this case, in the adjust phase, we're going to adjust the plan from 20 down to 15, continue on through the cycle. And like I say, a month from now, a quarter from now, whenever you decide to check it again, if you're still humming along at about 15, you kind of made the right decision. Now, let's say we got a different answer for them. Yeah, you guys came to us, a month ago to get this thing kicked off here. Unfortunately, since then, we've had a lot of staff turnover. We just brought on a new guy, Bill. Bill's kind of an expert in this kind of stuff, so we assigned him to the project, but he's only been doing it for a week or so. So Bill needs more time to get this thing ramped up. So in this case, our adjustment is going to be to the resources. Resources can be obviously lots of different things. Can be people, can be time, can be money, facilities, whatever it happens to be. In this case, we've got Bill. We're going to put him in there, give him more time, ramp it up, go back through the cycle again, check and make sure that he's continually moving up towards that target of 20 here. There's a fourth scenario that kind of fits in there too. Maybe it's maybe we did overestimate the plan a little bit, and maybe we need more resources to get to that plan. So in this case, let's take the plan from 20 down to, let's say, 17. Put Bill in there, give Bill a bit more time, maybe bring in an outside contractor to help Bill ramp up the program here. So kind of 4 scenarios at any phase in time in the PDCA cycle here. Every plan or every piece of every plan is going through the cycle all the time. You kind of determine what the cycle is, whether you want to do it monthly, quarterly, whatever you think is right here. But you're going to keep those plans up to date. And this is what keeps the plans moving forward, whether it's the plan or the information around the plan, keeps everything moving in real time so you can always know where you are. Now, this is going to facilitate what we have now is the performance monitoring tools. So having all that real-time data is going to feed our performance monitoring tools. So what we're going to talk about now is the dashboard, which is kind of the namesake screen here. So I'm going to go back to our system here. I'm going to go to my groups tab again, my org chart. Now, everybody who's assigned as a user in the system is assigned to their default group. So obviously the WIC people are assigned to WIC and the emergency preparedness people are assigned to FEP. Typically, senior managers are assigned at the department level, meaning that they want to be able to look at the entire department on one screen if possible. So I'm going to go up to this little traffic light button. When I click on that, it's going to do about a bazillion calculations in the background. And it's going to come up and it's going to show me the dashboard, in this case for the entire department. What I'm going to see on there is kind of a snapshot of the performance of the department. This button right here is telling me what I'm looking at. So it says I'm looking at USA Public Health Department. Now, if I were the WIC director and I'd logged in, this would take me immediately to USA Public Health WIC, and everything on the screen would just be related to my area of responsibility. Now, given that, if I've been given permissions to, I can go back to my group screen, select any of the other groups, maybe the department level or some other group, and take a look and see how they're performing as well. But it's going to take you by default to your group. What you're looking at in the top left corner are the number of activities, objectives, or goals in each status. You'll notice when I roll over, they're actually clickable, so I can drill down and get to the data behind here at any point in time. The other thing I'm looking at up here is the schedule gauge. And what this is doing is aggregating all of those beginning and ending dates at the activity level together and comparing them to the percent complete and saying, you know, we're about 53 days behind schedule on everything that we're doing. 53 days is getting up there to where you're starting to get maybe a little bit concerned about it here. Most schedules, by the way, are fiscal year long. So 53 days is what, about 15%, something like that. So getting a little bit behind schedule, it's still yellow. If I get to 60 days behind schedule, it's going to turn red. Let me know that, oh, we need to figure out what's going on here. If I get on schedule, it's going to be green. So anything, you know, straight up and to the right is going to be green up here. But it gives me a real good snapshot of how we're doing against the assigned schedules, so I can go down and figure out what I got to do to get back on schedule. If I want to drill down a little deeper down at the bottom, I can look at three different things. First thing I can look at is my people. So everybody who's been assigned as an activity lead will show up down here. And when I come across, I can get a snapshot of exactly how that person is doing against their assigned plans. So the first thing I have is this last updated column. That's showing me the last time this person was in and updated their information. And you can notice it's color-coded. So green is less than 30 days, yellow is 30 to 60, and red is over 60 days. So just by looking down here, I can see we're mostly green, meaning most people have been in there. A couple of people who I need to maybe chat with and find out why they've been a little bit behind schedule here. FTE column is another roll-up of that FTE number you saw at the activity level. This is employee utilization. So based on all of the activities that Diane Cox has been assigned, she's running at a 1.25 FTE, or doing a job of 1.25 people. I might want to click on her number here, show me all the activities she's been assigned. Maybe there's some of those that are within William's skill set here that I can reassign and kind of get him up to that 1.0 level and get her down and kind of balance things out. Lagging and days is showing me the number of activities calculated to be behind schedule, and the days column is the same as the schedule gauge for the individual person. Overdue here is exactly that. The ending date has come and gone, and we're not yet complete. And then again, color-coded by how far. And then the red, yellow, green, and gold. So if you think about it, looking across any person on here, you get a great idea of how they're performing against their assigned plans. I also have the groups button and the priorities button, which gives me the same information here, but down this column would be my org chart. So my divisions, my offices, my programs. So how each of those is doing against their assigned plan. Secondly, or thirdly, I guess, I can go to priorities, and what this is going to show down here is the strategic priorities from our strategic plan. And how do all of the other plans feed the strategic plan? Strategic plan is typically your vision for the future for the department. So you want to make sure that everything else you're doing is feeding that vision. And that's what that will tell you in there. Top right corner up here, my priorities are individually selectable objectives that you want to keep your eye on. They're real easy. If I click on it, there's a little green flag. I click and unclick and get it back up on there. Typically, they're things that are yellow or red status, and typically they're things that either you're working on personally or your team is working on. I call it front and center, just stuff I want to keep my eye on. I can drill down on those and find out exactly how we're doing on that information. So this is the dashboard screen. We do suggest that everybody, especially supervisors and managers, use this Start Here button to make this your home page. So when you log in, you're going to go right to this dashboard screen for your area of responsibility. So you can look at that and say, hey, everything's working great, I'm moving on, logging out. Or there's a couple of things I want to check on and maybe make some corrections, then log out and move on forward here. Okay, you guys have been through the accreditation process. You're aware of how document intensive it is. This was actually developed for a bunch of health departments in Ohio who are, as you know, are mandated for accreditation by 2020. And what they were having problems with is just keeping track of all the documents before they submitted the 300 to 1,000 documents and go up into EFAB for accreditation. So what we did is we developed a way to actually attach the documents to any piece of any plan in the system. And also then give them a lot more information, like full descriptions, notes about them, the FAB expiration date that they require on the documents. You know, your chip is less than 5 years old, your workforce development plan is less than 2 years old, that sort of thing. And you can also flag the documents through their lifestyle with the traffic light. So, you know, a red is a brand new document, yellow is a draft, using multiple versions, and it automatically maintains version control for you. The green typically means it's done, it's ready to go, time to submit it up into EFAB. And then the gold bar indicates that it's been submitted into EFAB. So just let you walk documents through the life cycle, know exactly where they are, and that sort of thing. It's not just for accreditation, however. It's generic document management. A couple of things that we find people using it for a lot are, number one is policy management. So within the department, you've got a bunch of policies that have to be updated typically on a fiscal year basis. So what you're going to do is attach those policies to a plan that you create that says, you know, update department policies, and there's an activity for each plan in there, and the document is attached to the activity. So when the time comes around at the end of the fiscal year, there's a notification comes out to the person who's assigned to that says, you know, you need to update this policy. You download the policy, make the changes, upload the new version, and you're done. Now, the other thing that we see a lot is grant management. So any grant requires a bunch of documents to be submitted to get the grant typically. And then after the fact, you know, typically there's like a quarterly cycle where you're going to be providing documents on how well you're using the grant, that sort of thing. So again, it's just a place to attach the documents to a piece of the plan here, and it then helps you to remind yourself when you need them here. So document management, there's no limit on number of documents, size of documents, type of documents. You can put anything you want up in there. 3D planning. 3D planning is a categorization process that gives you a big overlay across everything in the system. So for instance, how are we doing against the 12 essentials of public health and accreditation? So what you're doing is tagging the pieces of the plans, in this case, that support essential number 1. What things are we doing in the department that support FAB Standard 6.1? Which pieces of which plans are supporting our strategic priority of partnering? This is where the bottom of that screen we were talking about comes in at the dashboard level. And then same thing with documents. Which documents are we going to submit for FAB Standard 4.2 when we're ready here? So they all get tagged in there. It's just a nice overlay that gives you the ability to look for commonalities, for gaps, for overlaps, that sort of thing. The intelligent real-time planning. This is the most used portion of the system, and it's kind of critical for that real-time updating. Here's how it works. Typically, after you're using the system for a while, you're going to set up the email notifications to go out on a monthly basis. Let's say the first Wednesday of the month, we're sending them out. Here's what happens. On that first Wednesday of the month, 2 o'clock in the morning, the system kind of lights up and looks at every user and asks 3 questions. Have you been in there in the last 30 days and updated your stuff? Do you have anything behind schedule? Do you have anything overdue? If any of those is true, I'll go to emails. If not, by the way, there's no spam. It doesn't send out emails. If you keep your stuff up to date, the system won't communicate with you. But in this case, you got internal folks and external partners. There's a link in that email, takes them down into this screen we call Quick Update. Quick Update was meant to be the simplest screen in the world because we don't even want to have to train people to be able to use it if possible. So what it shows you is the context of the pyramid above the activity, and then there's only 3 fields to update. You can change the traffic light, you can put in a data value, and you can put in a note. You hit the little next save button here, it takes you through all the activities you've been assigned, and poof presto, you're done. This typically takes somewhere between about 3 and 5 minutes per person per month. So instead of having to go to your folks and say, I need a couple of hours of your time every month to keep this stuff up to date, it's so simple that you can literally do it in a few minutes. What we find happens is, there's a lot of, show me. So people are going to go in and look at it the first time and say, okay, I'll give it a try. They give it a try, they look at their watch and say, wow, that took me 4 minutes to do. That's pretty cool. Next time it comes out next month, they say, yeah, I'm happy to do that. I'll get it off my desk for another month and I'm ready to go. So it really is a great tool to be able to keep information up to date. And as part of the live training that we do with the system, we actually train all of your users. Everybody who's going to be a user on the system, we're going to train them to do this, what we call occasional user training. Takes them how to, get their password and their user ID and how to actually utilize the quick update screens. And it's about a 30 to 40 minute training. And we also take them, by the way, through a mini version of this demo so they understand the context of what they're doing. Reporting, there are reports for everything in the system. The most common report is the operational plan report. Obviously, that's what's in the system. This is the one for the car seat program. So remember, it was under Community Health Division, Safe Kids program. You'll see the green here is when you attach a document, in this case, it's attached right to that service in there. It shows up in there and you'll have as many documents as you have in there showing up attached to there. The goals, the objectives, all the notes show up in blue in here. So it's just a nice status report on exactly how you're doing in this particular plan here. The reports are all, I can crunch them down by date range, or I can say, I just want to look at the goal level. I don't care about the objectives and activities, that sort of thing. So lots and lots of reports. VMSG Public. This is the ability to create public web pages of any of your performance indicators. So what it allows you to do, this is again, the one for the car seat program. At any level in the pyramid, I can create a performance indicator row, we call it. So in this case, this is the entire Community Health Division right here. So I'm looking at Community Health Division. If I roll over here, it's going to show me the number of activities in each status and the timeline. This is identical to the traffic light and the timeline gauge on the top left corner of the dashboard screen up there. Obviously, it's a pie chart instead of a traffic light. But I can get all the way down to the activity level here. So you see the rollover shows me the number of car seats installed each week. This, by the way, is fully isolated from the system. It puts out a web page that you can get to, but nobody can get from here back into your system. You can have as many of these rows on a page as you want, and you can have as many pages as you want. Bottom line is it creates a unique web address or URL that you can copy. You can put it in an email. People do that, by the way, for the quarterly Board of Health meetings. So what they'll do is they'll create a page that has every division office and program and their status, and then they'll send that off to the Board of Health members before their meeting so they get a kind of an update on exactly how the department's doing and maybe some areas to focus on in there. You can put it on your public web page. So you just have that link on your web page. People can click on it and look and see how you're doing against certain things like accreditation or whatever, reaccreditation. You can also put it on social media. So obviously you can embed a URL into like Facebook, for instance, on your department Facebook page so people can see the little baby version of this page you see here, and then they click on it and get the full version of it. So it's a nice tool to be transparent in public health. Built into the system are FAB accreditation and reaccreditation project plans. What we did is took all the information that FAB provides for accreditation and reaccreditation and crunched it down into operational plans. And here's what it looks like here. Back in the groups tab here, I have this FAB accreditation. There's a state, a local, and a tribal version of it at this point. We are trying to gather the information for the military version, which is going to be a little bit different, I understand. And, I guess one military base has gone through that already. But the accreditation plan, first of all, being a group within itself, has its own dashboard. So now if I look at that dashboard, I'm going to see the exact status of our accreditation or reaccreditation effort in the dashboard. So I can see how each person is doing against their assigned domains. I can see how overall we're doing against the specific activities, things I want to keep my eye on, et cetera. If I start drilling down in this plan, you'll see at the service level, you can see the 12 domains here. In addition, I have the 7 steps of accreditation. I go down here, you guys are probably in the annual reporting stage and moving into the reaccreditation stage as you go. At this level, it's just a bunch of kind of a very high level plan for these 7 steps. But when I go back to the domain level, first of all, let's go down domain 1. Obviously, the next step is going to be the standards here, but down here are the reaccreditation measures. So I go down to there and I look at the objectives, and it has the actual 3 reaccreditation measures for domain 1 in here. Now, the really nice part is when you go down to the activity level, is what it says is these are the 4 activities that you need to complete to meet reaccreditation measure 1.1 for this particular domain. Most of these, in fact, I think all of them require some kind of a narrative or some documents attached to it here. So describe the ongoing community collaborative process for continuous enhancement of the CHOP down here. This is the document management screen on every page. I click on that. It's going to go here and say I've attached this accreditation checklist document, whatever that is, to here. I can modify the document. I can put up new versions of the document, whatever I want to do. But it's attached right to that activity that's attached to that measure. So you kind of always know where it is in there. You can always refer to it. So that's the accreditation project plan. What a lot of people do in the reaccreditation process is you can go through and eliminate all the standards in here. You don't necessarily need them, but just work on the reaccreditation measures. So what it does is scale down your dashboard view and that sort of thing, but purely up to you. And you can have as many versions of this out there as you want. But what it allows you to do is basically assign people at each domain, which a lot of people do is assign domain leads or domain managers, assign them all the way down to the activity level. We can push that down for you in one fell swoop. So you get those people assigned, you get your dates assigned that say, we want all our documents turned in by December 31st or whatever that date is. As soon as you do that, you now have the real-time planning process engaged. So you got the people who are going to get the emails based on the dates, and they're going to be directed to keep the information up to date, put the new documents up there, whatever happens to be in there. So it's a nice tool to walk you through the plan. Everybody can look and see exactly where we are on the accreditation process. You can create a VMSG public page about how you're doing on the reaccreditation process, whole 9 yards. If you do the reaccreditation project plan, you can also do a mock site visit, a virtual mock site visit. So in this case, as you go through and you put all your documents in there, you can have somebody come in, and we set up a unique user ID for them that allows them to come into your accreditation plan. They go through every activity and they grade it. So there's a set of fields that you can see down here: questions, comments, not met activities, QI, and then best practices. So they're going to put that in there. They're going to grade it with a red through a gold being fully demonstrated, red being not demonstrated, and everything in between. And then what you're going to be able to do as soon as they get through with their virtual demo, which, by the way, they can do from anywhere, so they don't have to fly in and, hotel and all that kind of stuff. They can do that from anywhere. You have a report available that's your accreditation status report. You go in and look at that report, and it's going to show you everything that you need to do to get ready for your final site visit. So it's kind of a pre-site visit tool, and it's built right in there. It's real easy to do, and it again, automatically generates the report for you. Quick start. This is what we do to get you up and running. We only work with public health departments, and what we want to do is from the time you purchase the system, we want to have you up and running as quickly as humanly possible here. So here's what we do. We ask you to send us a few pieces of information, things like your org chart. We'll put that in there. Your user list, obviously, your logos, your page headers, that sort of thing. So it's now a personalized dashboard. There's an email that we're going to turn around and send you out that says, here's how you get your user ID and password, here's how you get in the system. And by the way, here's a link to the online training modules that are built in for every function in the system. So on the first phase of the training, what we're going to do is ask your folks to go through the online training modules. They're not very exciting. You don't want to do them at 2 o'clock in the afternoon after a big lunch, but they are very, very concise. So we're going to go through that for a couple hours of training at some point in time. And they're only 3 to 4 minute long modules, so you can spread them out as much as you want. As you're doing that, we're going to ask you to send us 1 or more of your primary plans. Obviously, since you're accredited, you have those. So we're going to say, let's put your strategic plan in. We're going to structure it into the system for you so it fits right into that pyramid. And we're going to enter a portion of the data, maybe up to half of the data in there, just so you can see exactly how it flows into the system. The other half, by the way, we're going to use as we do some live training for you. For the folks that we, the data that we put in there, we're going to help you, or we're going to get online with you and go through and assign the objective and activity leads, the people who are going to guide those activities in there. We're going to set up the real-time planning notifications so they go out on whatever time frame you want, typically, again, once a month. At this point in time, you're live, meaning that those real-time notices are going to go out. People are going to be updating their information. You got part of your plan in there. Now we're going to go into some live training sessions. The first one is you're going to kind of typically form a team of people who we call the org admins, the administrators, and the planners. Those are the folks who are going to be mostly responsible for building plans or putting in existing plans, and actually, you know, the kind of the core team. They also become part of the train the trainer process. So your folks are going to be very skilled in using the system. They're going to be able to help other folks. The next level training that we do is for if other people want to come on and actually learn how to build plans in the system. In addition to the online training, we take them through that. And then the third level of training is what we call occasional user training. And that's just for the folks who are going to input the information based on receiving the email going into the quick update screen. It's about a 30 to 40-minute training, and the first thing we do is walk them through a mini version of this demo so they understand the context. They know what the system's about. They're not trying to put together that jigsaw puzzle with 1,000 pieces without having the box in front of them. This is what we're trying to accomplish, and here's where what you're doing fits into the system here. We walk them through that, and then we actually take them through, you know, how to log in and how to respond to the emails and what data you can put into the screens and all that kind of information. Again, about 40 minutes. And we do multiples of those to get all your people through the training. And typically we, you know, get 25 folks at a time or something on the phone to do that. Training, help, and information, again, I mentioned is all built in. I'll show you that. So right now I'm at the services screen here. If I want to find out kind of exactly, okay, what are these buttons and what are these fields and what do I want to do, I can always go to this little blue eye up here. It takes me to help and information. It takes me down to adding and managing services. And the first thing it shows me is all of the buttons and the fields and everything that's on this screen that I can use. Secondly, down here is a user guide. So it's the online PDF user guide, which is a little hyperlink. So it's got everything in it. And then third is this little video training module. On average, like I said, they're 3 to 4 minutes long, and it's just specifically about what you're trying to accomplish. So what a lot of people will do is they'll go back and do the little refresher on the video. They'll hit the back button and go back to the screen they're on and finish up what they're doing. All of those training modules are rolled up into these 4 training curriculums up here, anywhere from user level training, which is pretty much everybody. Administrators are the folks who are the administrators who are, you know, adding, managing users and taking care of categories and lots of different things in the background. Operational plan development for anybody who's actually going to be developing and entering a plan. We recommend that. It's only about 20 minutes, I think. Then the occasional user training is for those folks who are going to be responding to the emails. Again, this is the first level training before we go into the live training here. Quickly, cost effective. We'll show you the price model here. Dashboard, great way to monitor your area of responsibility. Kind of really recommend you use it after you get everything in there on a daily basis, just to keep track of how things are going. It's a nice snapshot. 3-dimensional planning is something you'll use when you want to look across everything for commonalities and such. The accreditation and reaccreditation process all built in. And then from an IT point of view, the system is completely cloud-based. Everything that you need on your end is just a web browser. On our end, we do all the backups, we do all the training, we do all the support, everything in there. So that was your drink out of a fire hose, as Andrea mentioned. What questions can I answer for you?
Ta-da! All right. Well, I'll open it up to anybody in the room here with me. This is Krista. Any questions? Observations? Comments? I've got nothing for you.
Wow. I'm going to assume I did a great job.
Yes, you did do a great job. I think they're digesting all the information. It's a lot to take in.
Yeah.
Hey, Krista, this is Melanie. I have a quick question.
Oh, great.
So thanks very much for that great presentation. My question was, as you were going through, I heard you talk a lot about the different FAB requirements, and you were mentioning how certainly we can use that to stay on top of the reaccreditation. My question for you is, as FAB updates their requirements of what's needed for accreditation, how quickly is this system updated to reflect those?
Yeah, as soon as we get, like, for instance, by the end of next year, FAB is talking about having version 2.0 out. as soon as we get that information, we'll be updating that information. However, you know, if you're in the process now, that 2.0 probably won't affect you. But yeah, we're updating that. Fab has also added a couple of other kind of sub requirements that we're looking at right now to add into probably even a different project plan for the I forgot what there's 2 subjects that they recently added, but yeah, we keep that stuff up to date very, very well.
We're on their newsletter, so pretty much every time that they're doing an update, you're going to get the information as well as we will, because we're on the same newsletter. And then we also plug into all the Fab webinars that come out to introduce new things. And then it's just a matter of a day or two, and Fred has got it completely updated.
Great, thank you.
Andrea, do you want to go over the pricing model with them?
Well, sure. It's pretty simple. What we did is we wanted to be financial.
Can I interrupt? Bob had one thing that he wanted to say before we move on.
I just wanted to say, we've been, a couple of key players here have been through a demonstration earlier. And we did work through the pricing model, and that's kind of not a consideration for us at this point. So I think, we use a system that we developed in-house to do similar things. And I think I'm going to need to take the rest of this time and talk amongst ourselves to kind of do some kind of high-level comparison. Because I know the point of this second demo is really to don't worry about the pricing. We talked about that first.
Okay, great. Also, I just wanted to let you know that typically when we are working with state departments, that like the state of North Carolina, they did a pilot, and we call them an evaluation account. They called it a pilot, but I just would sometimes the best comparison is maybe getting a few people into the system to work with it for a while. And well, of course, it's going to be new, so we'll be the underdog. But having some people do a pilot with us will give you a great comparison. Just a suggestion.
I like that idea, and I think that's what I'm really hoping comes out of this, is that we have a select pilot, and people can kind of see if this is something, because this is a large organization. Yeah. We wouldn't just, hey, let's do this now. We wouldn't just do that. So
no.
Yeah,
no.
We did it over phases. We with North Carolina, of course, they put all of their departments on there. So, but as far as a state department, it's usually best to have all key people involved, and when we implement, then we gradually build on that process. We call it progress over perfection when we're doing the larger departments. It's just a building block.
Yeah, agreed. Honestly, we're going to go from 2020 is our reaccreditation year, so this, in my mind, is like this is the 2025 tool.
Right.
If we were to go that direction, that would prepare us and make the 2025 cycle easier. So thanks. We'll talk about this internally. We'll get back to you. And Krista's back for.
Thanks, you guys. We really appreciate you joining us. All right. Thank you.
Thank you, everybody.
Thank you so very much for everything.
Thank you.
We'll be in touch.
Thank you.
Pleasure. Thank you. Bye-bye.
Bye.